Our lead story at this hour, the government confirms the arrival of Astrazeneca doses tomorrow. But as the vaccine faces issues on efficacy against the South Africa variant, a World Health Organization panel maintains it is safe to use. We go above and beyond the headlines with Doctor Nina Gloriani, head of the Department of Science and Technology Vaccine Experts Panel. Thank you so much for joining us, Doctor. First of all, let's talk about that vaccine that we have at the moment, which is Synovac. You were yesterday inoculated with the Synovac vaccine, its first dose. How effective do you think, Doctor, is this vaccine against the more transmissible South Africa variant?
Well, we do not have data on that yet. What we have data, which I just got this afternoon, is a preprint for the variant of the Brazilian variant, not the South African variant. So it's not as effective now with the Brazil variant, but we have no data on the South African variant.
When do you think, Doctor, will we get data and research about the efficacy of the Synovac vaccine against the South Africa variant?
I think they should be working on it now. All of these vaccine companies should be working on their efficacy against all these variants, not just the South African, but the UK, the Brazil, and many other emerging ones. Of course, the most difficult one or most problematic right now is the South African variant.
Indeed. And I was just talking to several doctors earlier today, and some of them have already been inoculated with Synovac. And they say, Doctor, that Synovac is an inactivated vaccine and theoretically more resilient against any variant strains. What do you have to say to this?
Well, it could be that way. You know, being an inactivated vaccine is a whole virus vaccine. So there will be many other antigens in there, while the other vaccines that are based mainly on spikes, and it is the spikes that are the source of the escape mutants, you know. So it is possible that it may just be like that. It will not be affected so much, but we do not know because right now, as I said, the preprint from the Sinovac with the Brazilian variant showed that it has lost some of its effectivity already.
All right. Now, we will be receiving the AstraZeneca vaccines tomorrow. What are your studies and research saying? Because we are set to receive 487,200 doses of the AstraZeneca vaccine through the COVAX facility. Is it as effective? Is it effective against the South Africa variant?
Okay, actually, the AstraZeneca has only about 10% vaccine efficacy against the South African variant. And that was the main reason why I think South Africa refused to vaccinate more of its people with that. It was only 10% versus, well, the others had 70, 60, even 90%. So it has lost. It is because the South African variant has so many mutations compared to the other variants. So that's 10%. But if we have it here, we have to be quick in administering the vaccine so we can generate as many immune people as possible. You know, that we are racing against time. It is against the variant viruses that we are in the race for. So we have to really work fast with vaccination. There will be some cross-reactivity pa, no? So there's still some possibility na they will bind. So, but we just need to work fast.
So Doctor, share with us, why are we seeing the efficacy of the AstraZeneca vaccine against the South Africa variant down to a mere 10%?
Yes, because 90% of the cases in South Africa are already the variant. Now, the vaccine was produced with the original virus. So with the variant now, 90% of the virus circulating in South Africa, you don't really expect the vaccinees to produce antibodies that will bind that. So 90% of those cases are already South African variants. So only 10%
So, so,
retain the original.
so, Doctor, some experts are now saying after the 2 doses of AstraZeneca, uh, it may need or you may need a booster shot. What is a booster shot? Are you taking away a dose from one of the 2 doses that are
No.
being administered to
No.
an individual? What is a booster
No.
shot?
Yes, usually what we refer to as a booster shot is an additional shot to the primary series. The primary series of vaccines in this case, in most of these vaccines for COVID right now are 2 doses. So that's
Right.
the primary series. You have to give 1 dose, first dose, and then a second dose. Now, what I think they are saying is about another dose being given to be effective against the variant. And that will probably be the second generation vaccines we're talking about, not anymore the first generation vaccines we have.
Briefly, tell us, what have you researched and studied about the other 2 vaccines coming from Western drug makers, Pfizer and Moderna? Are they going to be effective against the South African variant?
We do not have enough technical data that are really published. What they have are for the UK variant where they have lost some effectivity already. They have lost some binding, but not much. But that was the UK variant. So we're still looking for the technical data on the South African variant. And also, by the way, when they did for the UK variant, they did it on pseudovirus, which is different from a real world situation when you inject the virus, the vaccine, and then in an area like South Africa, where 90% of the circulating variants are South Africa. It's entirely different. So the data may not be actually very comparable because of the differences in the laboratory procedures done.
Thank you so much for joining us on Newsnight and for your insights, Dr. Nina Gloriani, head of the DOST Vaccine Expert Panel.